What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy, and having a great weekend so far, and hopefully testing negative for all these viruses. It is time now for the Saturday edition of the Virus Update for Saturday, June 14th, 2025. If you're new to my channel, welcome to my channel. You have clicked on to the channel that gives you updates on all the viruses that can make us sick. There's a lot of different viruses out there. There's a lot of different things out there that can make us sick. This is where you can come to stay informed. Want to stay informed? Subscribe down below. Give today's video a thumbs up if you like today's video. Let's try for 175 like button hits. Share this video with anyone you know. And of course, leave your comments down below. Alrighty, we do have several things to take a look at today. Several things in the news. One of those being something we missed earlier in the week. Then we have some other data to take a look at and some new data from CJS today as well. Starting off on the international front, Bangladesh reports 2 COVID deaths in 24 hours, and they also report that 15 people have tested positive for COVID there. So they are dealing with more COVID cases of their own in that area at this time. All right, in India, I know every time we go to India's website, we are always greeted with all these advertisements. Someone's going to comment down below and say, oh, try ad blocker. We have, and here's the problem with that. Some of these websites say, oh, you can't come view our news stories if you have ad blockers on. So it's kind of a lose-lose situation. But anywho, India, the active COVID cases rise once again to 7,400, 269 new infections reported, and 9 deaths. So they did add 9 deaths today, and I get it. India, they have a billion people there, but hey, they are dealing with a wave, and chances are if they have 7,400 active, the real number is likely many, many times higher than that. In Canada, measles crisis. Now, I don't like how they word this title, but measles, there is an issue. Canada, measles crisis. Alberta in panic over worst outbreak in 45 years. Yeah, this is not good. Alberta is facing a severe measles outbreak with 868 confirmed cases since March of 2025. That's a lot of cases just since March. This is the highest that they have seen in this region since 1979, and their all-time high count goes back to 1957, where they had 12,337 cases. I don't think they're going to hit that this year. I mean, yeah, I don't think it's going to get that high, but it's something we'll keep watching. They definitely are likely to go well over 1,000 at this rate. Speaking of measles, in Boston, person with measles visited a Boston hotel, museum, airport. Health officials warn. And yes, this is a person who was infected with measles last weekend, and they did go through several different places in Boston, including the airport, also the Museum of Fine Arts, on, it looks like Saturday and Sunday of June 7th and June 8th were the times of exposure. I'll have a thread with today's, or a post on my website with today's news stories, and this will be included. They also flew on to Miami on JetBlue Flight 639 on Sunday, departing at 9:12 p.m. So, yeah, this is not a good thing. All right, taking a look at the variant picture. Here's the latest variant picture for Europe, excluding the UK, to early June. The LP.8.1 variant continued to dominate, but fell to 38% frequency. XFG COVID variant grew strongly to 30%. I think that's the one we're going to be watching this summer. There's also, of course, the NB.1.8.1, but XFG is really got some meat to it, and it's starting to really take off. Take a look at this. Here's the latest variant picture. This is Mike Honey once again with a globe scope to late May. The NB.1.8.1 variant just dominated but appears stalled at around 30%. The XFG variant accelerated to 22%, on track to take over. So he is saying XFG could very well take over at this time. And you can see here that he is talking about, in this chart here, you can see there's a lot of different variants. You got JN.1, you have XFG right here, this pinkish purplish color we'll call it. And you can see it is definitely trying to head to the potential of a takeover here in the United States. All right, here's something that came out Tuesday, which we did not see, and this was the update in Vermont. And for the most part, Vermont is low at this time when it comes to COVID. They are doing okay, but they do report that in the last week there were 2 outbreaks reported. It looks like they were in Bennington, Vermont, Bennington County, Vermont. The previous week there was only 1 outbreak reported in the state of Vermont. And we can see here overall, wastewater's not doing bad, but it did rise ever so slightly in the Montpelier region. All right, updating you on something from yesterday in Texas. And that is, there was no measles update yesterday, and I've seen several news stories say that they did not report any new cases. I don't know if it's that they didn't report new cases or they just did not update, but I do know on the Tuesday update, as you saw in yesterday's video, Dallas is going to be added because Dallas reported its first measles case. And if you did not see the United States update, well, here it is. The United States did report an increase in measles once again to 1,197 cases in yesterday. Someone asked, well, how do you know that the majority of those cases aren't vaccinated? Well, because it says right here that unvaccinated or unknown status, 95%. All right, moving on. My website is datareport.info. Here, I'll show you the homepage for that. And nothing really new to show you here, but right here, click on Virus Update News Stories and Data Sources. That shows the news stories and posts that I use. It also does have a thread, and this is legitimately a thread, with lists of sites and pages used in my videos. I'll probably have to add a couple things to that, because there have been a few new things that we have been using lately. All right, taking a look at what's going on with the air qualities in the United States, and I hate to say it, we still have problems when it comes to air qualities. Take a look at this, but it's not as bad. You can see here in the portions of the Mid-Atlantic, like Delaware, Maryland, New Jersey, Pennsylvania, still really bad. Also bad back near Chicago and Wisconsin as well. Some bad air qualities in Southern California. And Mexico still has a few problems, as does portions of Alberta, but improved from what it was. But yeah, really bad here. Take a look at this. Down just north of D.C., Harrisburg, Pennsylvania, Baltimore, Philadelphia, yeah, even up into New York City. Yeah, bad air quality today. Not good. I'll be limiting my time outdoors this afternoon. Taking a look at the viral activity levels for Canada. COVID-19 is moderate. Flu A is low. Flu B is low. And RSV is in the low category at this time. Let's take a look at what's going on with EMS calls in Florida. Pinellas County, Florida does see 1, 2, 3 sick person calls at this very moment. This is a live look in, and we can see everything else. Really, not a lot of calls. There's a few, but not like some days that we have seen. Philadelphia yesterday had 854 EMS incidents. That, my friends, is not a good thing. Live looking at Montgomery County, just outside of Philadelphia, shows Horsham, Montgomery County. I was near that area. I think I was in that area this morning, wasn't I? Cardiac arrest. So that's not a good call. Taking a look at what's going on in Chester County, was not there this morning. I generally don't always end up out in that area. Sometimes I do. And taking a look here, we can see Chester County does have a few calls going on right now. And the hospital situation in Pennsylvania today is not bad. This is better than we have seen for about a week now. Just only a handful of hospitals dealing with problems today. In New Jersey, last I checked, only University Hospital has a psychiatric issue. Once again, let's refresh this just to be sure. And yeah, that's the only thing there that is a problem in New Jersey. New York State, 433 COVID cases were reported yesterday for their Friday update. And when we take a look at New York State hospitalizations, let's refresh this, shall we? We can see that overall they have leveled off. They're not trending upward yet. They may soon, and the XFG variant would be the reasoning for that if they do. Taking a look at Ohio, which Ohio has not really updated this week. Now, I did have this set for the month of May. These are the outbreaks in Ohio, and I'm going to have to set this once again. We want to set this to May 1st through to, well, the most recent update, which would be June 7th. And we can see respiratory outbreaks. Northeast Ohio has had 9, we'll say within the last month or so, month to month and a half. Northwest Ohio has had 7. Northeast Central has had 4. Southeast has had 0 respiratory outbreaks. 1 in Southeast Central, 3 in Southwest Ohio, 3 in Central, 1 in West Central. So, yes, they are still dealing with respiratory outbreaks, even though we have gone into the warmer season. And with the summer wave of COVID coming, well, we could see a few more outbreaks pop up here. Heck, there could be a lot if it gets really bad. taking a look at the epidemic status for COVID, we can see it is likely growing now in California. And California this week, if someone asked me, what's the most concerning state right now in the United States? If I had to say anywhere, it very well could be California. California is trending in the wrong direction. I'll show you more on CJS's numbers in just a moment. Latest variants of COVID. LP.8.1 barely still dominant at 38%. NB.1.8.1 about to take over at 37%. Whether we actually see that before the next update remains to be seen. If you recall, yesterday they announced on this CDC Nowcast page that they will not be updating as frequently. XFG is at 8%. By the time we get to the next update, that very well could be the dominating variant, because just based on what it's doing globally, it looks like it is really taking off. Alrighty, let's take a look at emergency department visits diagnosed with COVID. We'll just quickly go through this. Let's set this for all the states. Then we're going to go to some CJS data. First off, nationwide, has still leveled off slightly. Alabama has dropped slightly. Alaska, you're bouncing up and down a lot. Arizona has leveled off. Arkansas has leveled off. California, yeah, you're starting to rise and you're slowly starting to pick up the pace. Colorado has leveled off. Connecticut has gone up slightly. Delaware, at the end, a very slight increase. Washington, D.C. is starting to rise. That's concerning. There's a lot of political action going on down there today, which will draw large crowds. Have to keep an eye on that. Florida, yeah, Florida, you know what, would probably be the second most concerning state. When it comes to emergency department visits, Florida's right up there. That's pretty concerning. It's really starting to take off there. Georgia is also flat at this time. Guam has gone down. Hawaii is rising slightly. Idaho has dropped. Illinois is flat. Indiana is doing okay at this time. Iowa's still fine. Kansas, still flat. Maybe a slight uptick at the end. We'll have to keep an eye on that. Kentucky is still okay. Louisiana's dropping. Maine is starting to go up a little more. Maryland is okay. Massachusetts has gone down slightly. Michigan is flat. Mississippi is dropping. Montana is up slightly. I think that's up slightly. We'll call it flat to slight rise. Nebraska is still flat. Nevada is okay. New Hampshire is still okay. New Jersey going up slightly. New Mexico is going up slightly. New York still okay after a slight rise. It's gone back down a little bit. North Carolina also has gone back down a little bit. North Dakota is okay. Ohio has leveled off from its drop. Oregon is going up slightly. Pennsylvania is flat. Rhode Island, a little bit of a jump at the end, upward. That's not good. South Carolina is still flat. South Dakota, we'll say that's okay for now. Tennessee is actually gone back down a little more. Texas is still okay. You know what? It may be going up ever so slightly. Utah is still dropping some. Vermont has come down considerably. Virginia, still okay. Washington, this is the state of Washington. Ever so slight rise, maybe. Now, actually, you know what? At the end there, that looks like it's gone down a little bit. Hard to see. West Virginia is still flat, and Wisconsin has dropped slightly. Alrighty, let's take a look at some data from CJS. I was going to show you wastewater scan. I think we're going to save that for tomorrow. I do have written down here a couple wastewater sites that we need to take a look at, but we will do that tomorrow. Alright, several things from CJS. I don't know if we're going to do all this today or do half today and finish tomorrow. We'll see here. Saturday's virus update notes. Before we get to that, I have to tell you something. First off, let's take that hydration break, shall we? Water's a drink of choice today. Very important to keep ourselves hydrated. Alrighty, doesn't that feel much better? So first off, I have to tell you, tomorrow is Father's Day. If you're planning on visiting someone in a nursing home, maybe it's your father, maybe it's a grandfather, whoever in a nursing home, please make sure you test beforehand. And I know you don't like hearing the words masking, but it may not be a bad idea. You don't want to be the one that causes a nursing home outbreak, and we want to keep our loved ones in the nursing home safe and not sick. So please, tomorrow is Father's Day. If you're going to a nursing, even if you're just going to visit someone at home, please do so safely. Alrighty, taking a look at some numbers from CJS. The Thursday numbers first. Florida, daily number, 527 new cases and 10 new deaths. Includes one from 2021 and one from 2024. New York, this is a daily number, 509 new cases. Puerto Rico, 405 new cases. Colorado, weekly number, a 3.9% test case positivity rate, up from 3.3% last week, and 2 deaths reported by the CDC data tracker. Connecticut, weekly number, 421 new cases and 3 deaths reported. Hawaii, 251 new cases this week. That's a weekly number. The rest are all weekly for Thursday. Indiana, 191 new cases and 5 deaths reported by the CDC. That's odd that Indiana's weekly. They used to be every other week, but hey, this is good news. Kentucky, 179 new positive tests and 3 deaths reported by the CDC data tracker. Oddly enough, the CDC data tracker, he says, now shows Kentucky with 22,222 total COVID deaths. Massachusetts, 525. Minnesota, 293 new cases and 9 new deaths. Nevada, 217 new cases. New Jersey, 11 deaths reported. New Mexico, 188 new cases and 1 death reported by the CDC. North Carolina, let's scroll down a little bit. 329 hospital visits for COVID-like illness. The CDC shows 104 COVID-related hospitalizations in North Carolina and 7 deaths reported by the CDC. All right, let's just finish the rest of this, shall we? Now, I do want to read this little excerpt. This is what he put at the start of his post, and I think it's important. And we're going to skip to right here. He said, there's troubling news from California, which will be mentioned below, which is that the COVID test case positivity rate rose quite a bit by their standards. Testing rates there don't move quite as quickly as it would in other states because of the size of the population there, which perfectly makes sense. And he says, I know that they're in the beginning stages of their typical summer COVID surge, which typically begins around Memorial Day. But given what's been happening there, I think the Golden State could be in for quite a rough summer, he says. And yeah, I'm concerned about California as well. Some of these pages I look at are not trending in the right direction for California. All right, Friday, daily number from Florida was 538 new cases and 3 new deaths, and 3,408 cases and 34 deaths reported over the past 7 days to go along with 392 reported hospitalizations. Florida is definitely trending in the wrong direction. New York, 438 new cases reported yesterday and 3,006 reported over the past 7 days to go along with 284 CDC reported hospitalizations and 20 new deaths. Puerto Rico, 428 new cases, 2,487 cases, and 14 deaths reported over the past 7 days. All 14 deaths reported this week were reported on Monday to go along with 144 CDC reported hospitalizations. Yeah, Puerto Rico is in a surge. The rest of the numbers are weekly tallies. Many states below too low to justify posting here, which, hey, that is good news, he says. Arizona, 711 new cases reported by the state on Wednesday and 2 new deaths. California, yikes, 2,868 new positive tests, a test case positivity rate over the past 7 days of 4.47%, up from last week's 3.72%. And, oh, yikes, this is not good. 551 CDC reported hospitalizations and 22 new deaths. Yeah, that's going up much faster than we would like to see. Idaho, 290 emergency department visits and 1 death reported by the CDC data tracker. Louisiana, even when Louisiana is lower, they still spit out 551 emergency department visits, a test case positivity rate of 3.7%, up from 3.3% last week, and 1 new death. Michigan, 129 CDC reported hospitalizations. Cases and deaths are typically reported on Tuesdays and Wednesdays. Mississippi, 5 deaths. Ohio, 7 deaths. Oklahoma, a test case positivity rate of 3.6%, up from 2.9% last week, and 5 deaths reported. Pennsylvania, 143 CDC reported hospitalizations, and just 1 death reported this week. Texas, 1,129 new cases, 258 CDC reported hospitalizations, and 20 deaths. So you can see here, Texas had 258 hospitalizations reported versus California, which already had 551. That shows you how bad things are starting to go in California. This is not good whatsoever. I do have to wonder, and I hate to even go there, is what's going on in LA have anything to do with that? I honestly don't know, and now we zoomed out too far. Here's the rest of this, and we do see here that West Virginia, 266 positive tests reported over the past 3 weeks, and 1 death. Wisconsin, a test case positivity rate of 2.8%, up from 1.9% last week, and 1 death reported. And then he says the CDC reports a national test case positivity rate of 3%, up from 2.8% last week. 3,415 nationally reported COVID-related hospitalizations, and the CDC data tracker added 196 deaths since last week, which, from my understanding, that's the lowest number in a long time, and now shows 1,229,069 total COVID deaths since this all started, up from 1,228,873 it was showing last week at this time. He says he wouldn't be surprised if some of the death counts via the CDC data tracker were net counts, but at this time, he is drafting this post. He can verify that any deaths were removed from the CDC count. So remember that issue a while back. It looks like maybe that has resolved at this time. But he also added this. Of note, the 4 deaths the CDC data tracker added for Tennessee this week places the volunteer state at 31,000 total COVID deaths per the CDC data tracker, though before they stopped counting COVID deaths at the state level, Tennessee's state reported count was slightly higher than that. All right, that does it for the Saturday edition of the Virus Update. We will have another Virus Update again tomorrow with the latest wastewater data and whatever news pops up. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course leave your comments down below. I will see everyone again next time. Until I see you again next time, stay safe everyone, and have a fantastic Saturday afternoon. Thanks for watching.